So, good afternoon, everyone, or good morning, depending on where you're calling in from. Thank you for joining us for today's free webinar hosted by Prevention Plus Wellness. My name is Dr. Chudley Wirch. I'm CEO and founder at PPW, Prevention Plus Wellness, located here in beautiful St. Augustine, Florida. And I hope you're well and do very much appreciate you signing in today for this webinar on implementing prevention plus wellness programs with success. So we had this webinar maybe a couple years ago and I updated it. I think it's a good one. It does not replace training as an implementer. And our most popular training is the online self-paced program implementer training, which is self-paced. You take it on your own day or night, weekends, weekday, whenever, about 2 hours in length, hour or two, and you get a certificate as a certified implementer. But this webinar will give you all that you need to know as an introduction to how to be successful. And so it's a nice addition for those of you that have been trained as implementers or that are interested in learning more about prevention plus wellness programs. So this will last about an hour, I think I mentioned, and at the end we'll have time for Q&A. But as we go along, if you have a question, please type it in that Q&A space. Find that on your toolbar, and not the chat space, but the Q&A space. That would be best. And you will be receiving from me a link at the end of today, and that link will take you to the recording of this webinar and the slides, which you can share with your friends and your colleagues. You'll also get a certificate, a 1-hour CEU certificate, which you can type your name on and print out for your records. So all of that comes with today's webinar. So again, thank you so much, Jen. God bless you for what you do for promoting the health and well-being and protecting young people and their families against substance abuse and helping them with their mental health. And we're partners in that. So if you need us at any time, do find out what we offer at preventionpluswellness.com. So let's go ahead and begin. Let's take a look at the objectives for today's webinar. The first is we're going to go through the steps for implementing PPW. Again, that's prevention plus wellness programs for youth, for young adults. We even have adult programs. And we'll be talking about how you or anybody can implement a PPW program to your participants in a group setting. So that could be a classroom, it could be a sports team, any kind of a group, individually, one-on-one, and even virtually. Secondly, we're going to look at the tools for evaluating a prevention plus wellness program. Even though PPW programs are evidence-based, we have built-in evaluation tools so that you can assess the quality of implementation as well as the outcomes. And then lastly, we're going to look at some common challenges that we have learned about over the years of implementing our programs and having teaming up and partnering with the providers throughout the country like yourselves to implement the program. And there have been a number of challenges, not many, but I think important ones to raise and to talk about the solutions to these challenges. Like any prevention, intervention, treatment program, there's going to be challenges. We'll talk about the ones that we've seen and solutions to those challenges. Okay? Now, before we go any further, let me ask you to participate in a very brief poll. And I'm going to pull that poll up right now. And so here it is. I'm going to launch this poll. Let's see, there it is. And I'm launching it. And you'll get it in just a moment. And I think there's just, maybe it's just one question, actually, in this poll. And it's multiple choice, so you can answer more than one answer to this. So go ahead and do participate so we can see what your PPW implementation or implementer experience is, if any. And so the more of you that participate, the better able we'll understand who's online with us today and maybe tailor this training a little bit toward who is on the channel today, who's viewing the webinar with us today. So please do take a moment and just take literally a few seconds to complete this. And at this point, we already have 70% of you who have completed it, which is amazing, 7 out of 10. Now we have 77% have completed it, which is even more amazing. So great participation from you out there. So thank you all. And just give you another moment or two. Again, we have 78% that have participated in this very brief one question poll or survey. And now we're over 80%. So I'm going to pause at this point and I'm going to share the results with you. So the results are coming your way. And the question was, what experience do you have with implementing Prevention Plus Wellness programs? And you could check any of those, and you could see the majority of you, the greatest percentage of you, looks like 63% said they're interested in receiving training to implement PPW. That's awesome. That's great. And then the next largest percentage looks like about over a third, 37% said they're interested in implementing PPW programs. Another section of you, about 26% receive training. Another 22% said they're implementing one or more of our programs. And then, a couple of people, they don't know at this point. So hopefully we'll help everybody know what they need for implementation and give you a good overview of everything, give you some good information, some good resources for you regarding implementing Prevention Plus Wellness with success. So let's start out and take a look at, again, or just not again, but start out with just describing what Prevention Plus Wellness is. It's an evidence-based model. It's a version of a screening and brief intervention. For example, give you some examples: screening brief intervention, expert, screening brief intervention referring to treatment, motivation interviewing. These are all different kinds of models of brief intervention that are evidence-based practices. And that's why we say really PPW is an evidence-based practice, and we have specific versions of our programs. And it's a 3-step model. So a little bit unique in that it has screening and feedback, lesson feedback or individual group feedback, and then goal plan. So let's take a look at it, this 3-step process. First of all, you screen your participants. They can be youth, young adults, whatever the case may be, depending on which PPW program you have. And the idea behind the screening is to get the participants to think about their health habit, to reflect and become aware of their substance use and their healthy behaviors. Remember, well, if you don't know already, the PPW programs are holistic, multi-health, whole health kinds of interventions. Most of our programs address not just prevention of substance use, but also the promotion of protective, healthy lifestyle behaviors, particularly sports and physical activity, breakfast and nutrition, sleep and stress control. So that's the first step to behavioral change, to improving one's behaviors, is reflection, is awareness, and that comes about through the screening survey process. Secondly, feedback. And the feedback in Prevention Plus Wellness programs is designed to discuss the benefits of those health behaviors I mentioned: physical activity, sleep, nutrition, stress control, using positive, desired future images, cueing those, if you will, using image terms like fit, active, healthy, successful. This increases motivation for change. And then linking how these healthy habits and their benefits, their images, are harmed by substance use. That's why the behaviors are integrated within that feedback process. And then lastly, the behavioral initiation process is begun through goal setting and contracting. And this is where you have your participants set a goal, not just to avoid substance use, but to increase one of those protective health habits. And then they monitor that goal, a short-term goal setting 1 week, and then they monitor those goals for 7 days. And all of that's included in PPW programs. The goal setting, a calendar, monitoring log, all those tools are available. And this goal setting initiates the behavior change process and starts increasing self-regulation skills and self-efficacy. So that's the 3-step process. If I can pause right now, just to remind you one more time, everyone will, for those of you that may have come on a little bit late, all of those that are here today, you will receive a link to this recorded webinar and these slides, which have a bunch of links in them, so you can click on them and learn more. And I'll be posting those on our website, and I'll send you the link to this, so you can share the slides, you can share the recorded webinar if you'd like with your friends, with your colleagues, and then everyone will get a certificate for 1 hour CEU for those of you that have listened in today. All right, let's look at the steps for implementing prevention plus wellness programs for youth, for young adults, even for adults. Step number 1, you need to have order a manual, which comes with materials, and you need to get trained. That's what's important. Sort of 2 steps, but it's within one. Materials and training is really important. Now, you have 2 manual options. And by the way, again, let me just highlight, if you have questions as we go along, find the Q&A option in your toolbar and drop in a question. And then once we're at the end of the presentation of the slides, I'll answer those for you. So you got 2 manual options. Option number 1 is you have a physical manual and a digital download of your slides and all your reproducible materials. And there's an example of the sport alcohol drug prevention plus wellness program. You can click on that and learn more about sport PPW, an evidence-based program for youth. So that's one option, a physical manual with digital downloads. And so it's a one-time purchase. You purchase this and you don't need to continue to buy materials for youth. You can just make copies of what you need to present this to any number of youth for as long as you want. Option number 2 is the unlimited Prevention Plus Wellness Program and Training license, a license. It's per program, a license is per program, and this provides you as a provider, an organization with unlimited sharing of the program manual, PDF, and digital downloads of materials, and online program implementer training with anybody in your region during that license period. So this second option, this option 2, this license option, is really, we designed that for those that really want to have a large number of people in the organization or even their region who they want to invite to become trained and have access to the digital program materials to present the PPW program and then increase their prevention footprint. So I would say most often providers will start with the physical manual and then they'll order online training separately. We'll talk more about that in a minute. But many organizations, larger ones, or those that want to extend the prevention footprint and include other teachers and coaches and nurses and counselors and any youth even be trained and implement the program, a license is a good option. Okay. Any questions about programs or license? Let me know. Type it in the Q&A section. So there's 2 options for your manuals, and you've got a few options for training. I mentioned this already, the online self-paced program implementer training is the most popular of our training options, probably because it's so practical and easy. You get a link and you can go to the training portal anytime, day or night, weekends, weekdays, whenever you have time. Your training usually takes only a couple of hours. And so very, very practical for the online training. And that's to be trained as a program implementer for any course. And we have courses for most, if not all, of our programs. A second option is training as a trainer, a Prevention Plus Wellness trainer. Actually, we're having a webinar on that next week, Wednesday. So if you want to attend that, that's a free webinar. Go to our website, preventionpluswellness.com, drop in your name and email, and you'll get a notice of that. Or you can see it on our blog news section on our web site, preventionpluswellness.com. So we do offer an online training of trainer workshop. So that's for individuals that, they've received training as an implementer, they've implemented the program, and then they want to be train other implementers in the organization or the region. A third option for training is the online or on-site program implementer and trainer workshop. We can do this online live, we can do it in person, and so that's very flexible. That's for a group of individuals. And then lastly, brand new, we've got a youth leadership training in PPW. So this is where we give you the materials so that you can train your youth group in how to take the PPW model and influence the health and well-being of their friends and their peers in their school and their communities. So it's a great tool, I think, and that we've had a lot of interest in that youth leadership training. So those are some training options. So that was all part of step number one. Get your program materials, get your training. That's step one. Step two of the process for implementing any Prevention Plus Wellness program is to practice the script or the scripts found in your program manual before you implement it. So the simple as that, you practice so you feel comfortable with the script. The script allows you to, the advantage of the scripts is that it increases the reliability and fidelity of implementation across time and across implementers. So it doesn't matter if I'm implementing the marijuana prevention plus wellness program, or you are, we do it today or 5 years from now. If we follow the script, it's more likely to be the same reliable program because it's scripted. That said, a script is sort of a guideline and allows you still flexibility to use your own, colloquial terms and, put it in a conversational format that you're comfortable with. So, script implementation options. Here they are. There's actually 3 of them. Option number 1, very popular, is the group script. So when you get your manual, whether it's a physical manual you purchased or you purchased a license with a digital manual, you'll see that there's a group script, a group protocol. And this is when you present your lesson to 2 or more individuals. It could be a classroom, it could be any kind of a group, it could be a team, a sport team, or whatever the case. You have 2 or more individuals you're presenting it to, and then you'll follow that group script. Option 2 is the individual script. This is where you are meeting with a person, usually again a young person, individually, face to face, private setting, because you're talking, on other people hearing about as they talk about their personal health habits. And by the way, this individual script, we now include an option to present this as an SBIRT, that's screening, brief intervention referral to treatment, SBIRT, because we've included a validated screener, the CRAFT. So you can implement it as an SBIRT if you want to, or just follow the regular individual script. And many organizations throughout the country will use this with the higher risk kids, sort of as a selective or indicated intervention. So, like, for example, school diversion programs, if they caught kids using or some substance use infraction, oftentimes they'll use the one-on-one. It's a little more tailored, could be a little bit more powerful when you meet with individuals, individual youth versus, classroom. So you have those options. Option 1, group implementation, group script. Option 2, individual implementation, individual script. Option 3, there's 2 options within 3 actually. The first is you can actually present your lesson live. So you follow the script, probably would do it. You can implement live to 1 youth, use the individual script. You can implement it live to 2 or more youth, use the group script. And all you have to do with that is you follow the script and you use a conferencing platform like Zoom. We'll talk more about that in just a moment. Your other option here is our newly updated and revised online sport program. This doesn't require any training necessarily. This is a link to a highly interactive, entertaining set of videos and activities. It's taking the sport, our most popular, perhaps our most popular Prevention Plus Wellness program, and putting it into a course format so that you can present it in a classroom. If every youth has their own device, their tablet or whatever phone even, and then use the teacher can just facilitate that, or you could send the link to individual youth or young adults. So those are your options: group script, individual script, live, virtually, and even online, self-paced. That's step two. That was practicing your script. That's the main thing. Get comfortable with it. Practice it until you feel that you're comfortable and confident you can present it to your target audience. Step three, send any tailored slides to Prevention Plus Wellness for review and approval. Now you can co-brand your slides. You take your slides, the cover slide, you can change the color, you can put your logo, your organizations, your schools, whatever your organization is, your company's name on it if you want, that's up to you. But if you change the content in any way, send it to us so we can review it for you, give you feedback, and make sure that it still falls within the evidence-based model. So what is tailoring slides? By the way, not many organizations will tailor their slides, but it's an option. I wanted to highlight this for you and let you know. So option one is you can switch out images. In other words, images usually of the of youth. So for our high school programs, you'll see high school age youth. For the elementary school programs, you'll see elementary school age youth, etc. So we're trying to, and we are showing positive models representing those individuals that you're presenting this to, so they can see them engage in the health behaviors, physical activity, nutrition, sleep, stress control. So which young people are lacking nowadays. They're lacking representations, models, and these are electronic models. So if you're presenting, and by the way, in our slides, they're diverse and they have male, female, they have different ethnicities and different activities. But let's say you're presenting to a group of all Hispanics, for example, or maybe all females, then you'd want to have just all Hispanics, perhaps all females images. And so you can switch those out. That's all we're saying. If you want to switch out your images, positive images of your youth, do that, send them to us, let us review it. We like to see what you've done. We like to learn from you and share with others. And we like to give you feedback. Second option for tailoring is if you want to add some content. Not too many organizations do this, but a couple have, where they might add, just as an example, there was one organization that added a little extra content, one of the slides on high caffeinated beverages, which was an issue of concern with among their prevention providers and their students. So, and another organization added a whole new slide on SMART goals, SMART goals. So you're welcome to do that. We ask you to send any altered slides outside of just co-branding to us for review. Okay? So tailoring slides, an option. That's step four, locate your PowerPoint slides and make copies of your program's reproducible materials for your participants from your digital downloads, which is sent to the organization. Sometimes there's confusion, where's my digital download? Where's my reproducible materials, my slides? Whoever placed the order for you, that person's email, that's where the downloads are sent. The physical manuals, of course, will mail those to whatever the address is in the order. If it's a license, and then you get the downloads of everything sent again to the email of the person who made that purchase, and then they can share them with whomever they like. So copies. What do you need to make copies of? What do you for your participants? Well, you want to make a copy for every every student. Let's say you're going into a classroom, existing classroom, health education or PE or social studies or after school or team or Boys and Girls Club, doesn't matter, YMCA. let's say you're going to meet 20 students, 20 youth, make 20, maybe some extra screening survey copies, make goal plans for everybody, copies of those, make copies of the calendar log. The screening survey you'll implement, they can keep it. The goal plan, they'll complete it. They can keep it and post it. The calendar log, they take it and post it and track their health habits for 7 days. So all those things are for them. Item number 4 is for you as the provider. Now you can hand out a physical copy of the pre and post survey, which measures immediate outcomes before and after the lesson, risk and protective factor changes from that lesson, as well as an instructor survey, which measures a self-assessment that you complete, which assesses the quality of implementation. And you could make copies of these, but we recommend that you request online links, or we can even send you a QR code if that's better. But online links of these materials, the pre-post survey for the participants, the instructor survey for you, so that you can enter your data. Therefore, it eliminates any hand entering any data. You save a ton of time. And for the pre-post survey, it'll likely increase the honesty of the responses, the quality of the responses for young people. In other words, young people are more likely to answer honestly online, in an anonymous survey than they are in the paper and pencil in front of you. Speaking of pencil or pen, you might want to hand some of those out or make sure that your youth have those so that they can complete their screening survey, goal plan, and calendar log. So these are the things you make copies of from your digital download. That's step 4. Step 5, administer the pre-test. That's we recommend, again, the online version. Request it from us. We'll send you a customized link to the pre-post survey. And this is the time to implement that, either the paper version or ideally the online version. Show them the link. They click on it, they open it, they complete it. It takes about 6 minutes. So it's very brief and yet includes tremendous amount of important information for you as the provider, so that you can see what kind of impact you've had on the kids with the pre and post survey, and that you can not just feel good about and enlightened about, but you can share that with other providers, with your organization, with your schools, your communities, your youth, your parents, funding agencies, and then also see where you can improve your program the next time you implement it. So administer the pre-test to assess program outcomes. Step 6, implement the program using the selected script, the group script, the individual script. You show the slides. And so I want to highlight again the 2 virtual options you've got here. So virtual option number 1, not many people doing this, but we created this virtual option during the pandemic. It's still there. And so we've got 2 slides in your program slides that if you present this to one youth using the individual script, group of youth, the group script, presenting it on a conferencing platform like Zoom or Microsoft Teams or whatever, you've got 2 slides. One is a screening survey slide and another is a goal plan slide. So the challenge presenting the PPW program virtually is that your participants don't have the screening survey and they don't have a goal plan to participate in the lesson. So we've created a virtual version so that they can click on the slide and open up a screening survey and complete it, click on the slide and open up a goal plan and complete it. So that's how we've enabled you to present your live virtual PPW program to one individual or groups of individuals. That's the virtual option number 1. Number 2, as I mentioned earlier, we now have the Sport PPW program in an online interactive course. It's really exciting. We're wrapping this up. We've had it before, but we are updating it, and it is fantastic. I think we'll do a webinar on this, probably the first Wednesday of June to walk you through this because it's amazing. It's I think the future because highly interactive, highly entertaining, and you can present it in the classroom. You can send it to youth individually. So I think you'll really be able to have reach a lot of youth with this version of our program. And if you like it and we get feedback on it, we may do other of our programs in this interactive online format. That's step 6, implement your script, grouped, individual, virtual. Step 7, at the end of the script, you're going to walk the youth through the goal plan. You'll read the goal plan to them. They'll sign it and you co-sign it. Now, this is important. This is the contract part. So that will increase motivation for change. That's where the goal plan becomes a contract, a social contract between you and each individual youth. And you want to tell your participants to post their goal plan, post their 7-day calendar log, and track their health behaviors for 7 days. And then you can and monitor the goals achieved for 7 days. So you want them to focus on their goals. If they achieve some goals, which they likely will, that research shows that increases the chances of them having longer term goal success. But we have to start somewhere, and the short term 7-day goal plan is the preferred way to do that. That's step 7. Step 8, administer the post test. Again, if you request the digital version, we can send you a link to the pre and post survey. We also have, as a post test, we have a 1-month follow-up post test. We're trying to get more participants, more partnering providers to use the 1-month post test. Why? Because the 1-month post test doesn't just measure risk and protective factors, it also measures 30-day substance use and health habits. So you're going to actually be able to track changes in healthy behaviors and substance use if you implement your post test 1 month later. So we have a separate post test or an additional post test if you request it. It's for 1 month. But the reality is, most of our providers, if they do implement a pre-post survey, they'll do it immediately before and after the lesson, because coming back and trying to do a post test later is an additional burden and a challenge that many cannot do. But we do highly encourage using the 1-month post test. Just ask us for the link, we'll send it to you. Regarding the pre-test and post-test surveys, the immediate risk and protective factor changes: pre-test before the lesson begins, launch the lesson, complete the lesson, do the post-test before your participants leave. This includes 2 key risk and protective factor measures. The first is to measure behavioral intentions. Behavioral intentions is the most highly predictive measure of future behavior. So, and that includes measures of both substance use and healthy habits. So, in the future, will you vape an e-cigarette? In the future, will you get regular physical activity? Those are examples of behavioral intentions. The other risk measure is perceived harmfulness, and that's across 5 different substances. How harmful would this marijuana be, for example, if you used it regularly? How harmful would it be to your health behaviors and your overall well-being or health? That's perceived harmfulness or susceptibility, sometimes it's called. So within this risk and protective factor measures, we're looking at 5 substances: alcohol, tobacco, e-cigarettes, marijuana, and opioids, and 6 health habits: physical activity, 2 nutrition measures, breakfast and fruit and vegetable consumption, sleep, stress control, and health goal setting. And the post-test, I would like to add, has 2 qualitative, 2 open-ended items. What did you like best about the lesson? What did you like least? The and you want to encourage your participants to write as much as they can in these two areas because, in their own words, so what they like best will highlight essentially the benefits and what they've achieved in their own words. And so you'll see content about how it reduced substance use or increased awareness or increased motivation or increased health habits. Really, really good information for you to promote your program. And what they like least, in their own words, will give you some hints as to how you can improve your presentation of your PPW program in the future. So that's the post-test 2 qualitative measures. So these are the measures that you'll see in most of our pre-test and immediate post-test surveys. If you do choose to use the 1-month follow-up survey, post-test survey, the 30-day survey, you'll get measures of 30-day moderate and vigorous physical activity, eating healthy breakfast, eating fruits and vegetables, numbers of hours typically slept, setting fitness health goals, and 6 substances, actually, even meth use, at least one of our substances, alcohol, tobacco, e-cigarettes, cannabis, opioids, meth, and very important measure of mental health, feeling so sad or hopeless that they couldn't perform day-to-day activities. Really important measure because we've seen our PPW programs actually have an improvement in mental health. So that's the post-test. And step 9, encourage and reinforce youth to continue the weekly goal setting. So your lesson is having them set goals for 7 days, give them a calendar log, have them track that. Anything beyond that, any kind of encouragement you can give them to continue that process will benefit them in terms of increased self-control skills and self-regulation. By the way, you could always re-implement, and we recommend doing this, the PPW program at least annually. You could even do it every 6 months if you want to, every semester, as a reinforcement. So, speaking of reinforcing and rewarding, weekly goal setting options. So, how can you continue to reinforce them? Let's say, so some providers will have access to their participants a following week or maybe numbers of weeks. So if that's the case, you can just have them continue to set goals every week. What worked, and then discuss what worked, what didn't work, what have they achieved, what have been barriers, make it a group discussion, have youth help each other set goals, and reinforce that as a group experience. But you don't always, not everybody has that. And one of the great advantages of PPW programs is most of them are a single session, so you can get in the busy organizations and schools for that single evidence-based intervention. But what can you do nonetheless to reinforce and reward weekly goal setting? Number 1, give students additional copies of the goal plan and calendar log. Print out copies for them, give them to their teachers or whatever. If you're an organization that coming into a school presenting, you can give the teacher extra copies of goal plans and calendar logs and encourage them to hand those out every week and maybe take a couple of minutes to discuss them. 2, provide incentives or rewards for additional goal setting. Kids love incentives, anything positive. Step 3, present the follow-up lessons. So, some organizations will implement one PPW lesson and another. We actually have 2 multi-session programs, Sport 3, which is actually 3 lessons, alcohol, marijuana, and e-cigarettes. We have Sport Health Behaviors, which is 6 lessons. So there you can have extra content. But let's say you implemented the Sport single session program, you could also follow that by implementing the vaping e-cigarette program the following week or month if you want to. So you can present, and then any kind of additional resources or information or opportunities to engage in physical activity or sports or breakfast or nutrition or sleep or stress control will reinforce those health habits that are so critical to mental health, physical health, avoiding substance use, and performance and happiness. Step 4, you could present a parent PPW program so the parents learn the same positive behavior messages and goal setting at home, which would reinforce what you did with the kids in a school community setting. Also, lastly, number 5, we have a brand new healthy lifestyles workbook for kids. You can order those and you can hand those out, and you can maybe do an exercise from one of the workbooks at the end of your lesson, or you can use the workbooks for maybe even several more sessions, because it's loaded with a ton of interactive activities, but that also reinforce the messages of your PPW lesson. Any questions? Type it in the Q&A response and I'll get to it in a minute. Step number 10, complete your instructor survey. As the instructor, as the implementer, as the facilitator, whatever title you want to use. At the end of every presentation, fill out this very brief instructor survey so you can self-assess how well that implementation went for you. Very important to keep in mind what constitutes a quality presentation. Your supervisor or manager can actually use the instructor survey as an observational form to see how you present your lesson and give you feedback if they want to as well. What does the instructor survey include? These 7 items, very brief, 5-point scale of a great deal to none at all. Level of comfort presenting, very important, by the way. The goal is to try to get toward the high end of a great deal on all of these. Comfort, active presentation strategies, in other words, good eye contact, voice fluctuations, moving around, that kind of thing. Level of enthusiasm, because PPW programs are motivational in nature, and you are trying to get them excited and change their habits. You should really be excited as well. We think that's an important part of the messaging. Number 4, level of smoothness or continuousness, accuracy of following the protocol, lesson provided completely, not leaving anything out, and then participant responsiveness. So 5-point scale on all of those, with the goal being every time, or eventually, or hopefully most times, you'll be able to respond a great deal to that. So that's an indicator of the quality of your presentation. And that's going to vary depending on how you feel, the setting, the participants, etc. Step 11, refer to Prevention Plus Wellness Program Fidelity Checklist. And make sure that you are following those steps to ensure fidelity of implementation to your evidence-based PPW programs. Step 12, request data charts and raw data from implementing your pre and post survey online, instructor survey online. So you just let us know when you want the link. We'll send you the link early on in the process. Then you can just track your data at any time. We'll keep an eye on it too. Sometimes we'll do case studies. You can see these case studies published on our website, preventionpluswellness.com, under resources and case studies. We do highlight success stories. You'll all have successes, and oftentimes we'll do a little success story and we'll publish it on our website, and we'll share it with you for feedback, and we can promote you and what you do and learn from what you do. That's step 12. Step 13, don't forget to sign up on our website, preventionpluswellness.com, drop in your name, your email, so that you're on the list, so that you can get regular, usually weekly notifications of upcoming free webinars and resources and handouts and that kind of thing. What kind of populations can you implement PPW programs with? Anybody from children to young adolescents, old adolescents, to young adults, to adults. General population, universal prevention intervention for all these individuals, as well as high-risk individuals, like selective and indicated prevention. In just about any school, any setting, schools, and community, and as I said before, YMCA's, Boys and Girls Club, juvenile justice, school detention, sports, military. We've had our In Shape, the young adult program, implemented with Air Force bases, home settings, anywhere there's people. All right, challenges and solutions. 3 big challenges we've found. 3 big challenges: keeping students engaged, and post-pandemic, this has been an issue. If you're an organization that goes into other organizations, like you're a prevention organization or behavioral health, and you're going to go into a school, and that is a challenging, as you know, a challenging situation. So keeping students engaged during your lesson is a challenge. And so that's why we're discussing it. And getting school permission or getting an organization's permission to present your program, your PBW prevention and wellness program, can be an issue, and getting funding can be an issue. So let's take a look at solutions to all of these. First of all, solutions to keeping students engaged. Here's some ideas. Get trained on how to best implement your program. Training is important to understanding the PBW model and the tools and so on and so on. So that's step number one. Suggestion number two: use the program screening survey, use the stop and think discussion questions, and the goal plan. All of those three tools are opportunities for participants to actively be engaged in the lesson and to tailor to their personal needs and values. So you want to use those resources that you have in your PBW program. Number three, use the individual script, perhaps, or use the group script and present to a smaller, more homogeneous group if you have that flexibility. That can help with keeping students engaged. Number four, use incentives. Kids love incentives. Incentives for listening, incentives for participating. Could be the latest, snack fad. It could be a drawing for a couple of 3 prizes. It could be free time at the end of the lesson to go on their phones if they've listened, if they've participated. Step number 5, use the Healthy Lifestyles workbook at the end of the lesson, because there's many interactive activities, and then you can pick one of those if you have time and present that. And lastly, number 6, we have, believe it or not, it's come back, scratch and sniff stickers. We have PPW version. We have stickers that smell and that promote physical activity, sleep, nutrition, and relaxation. You can hand those out as incentives for listening and participating. And we also have a healthy behavior goal tracking chart. You can make your own. You can have your teacher, your coach, or whatever nurse post that on the wall, and everybody's name in the group could be on that. And so you can refer back to that, and there could be some group support for each other's goal setting, and maybe even competition across classrooms or across teams. So that's a great tool as well, the healthy behavior goal tracking chart. All these things are on our website at preventionpluswellness.com. How about solutions to getting school permission? You want to emphasize PBW is one lesson, so it's not going to take a lot of time. You want to emphasize that it promotes physical activity, sleep, breakfast and nutrition, and stress control, which schools are likely to see that their students are suffering from and causing problems within their schools because they're tired, they're jittery, they're moody, etc., whatever the case may be. So it's a whole health intervention, not just addressing prevention. It's a plus for any kind of setting, school or any kind of setting. Number 2, use the program resources on our website to educate school leaders of the benefits of PBW. So we have under Prevention Plus Wellness, we have resources, and then program resources, and there's videos and flyers and brochures and all kinds of things. Also under those resources, there's number 3, it's called a PBW program decision maker survey. If you can get the decision maker, it could be a principal, a vice principal, it could be whatever, whoever's a stakeholder in that organization, you could walk them through that survey, and they could self-identify what they want for you to present to them. It's a great tool. And lastly, inform school leaders that PBW program options include addressing alcohol, marijuana, e-cigarettes, opioids. So they may have different interests in terms of substances in their school or organization. And then what are some solutions to getting funding? Use the PPW grant services and sample proposal on our website. That's preventionpluswellness.com under resources. Use the PPW's logic, model, and theory page in your grant application. Use PPW's evidence-based information in your grant application, and let us know if we can help you. We can help you select the programs and help you budget what you need if you want to use PPW. We even have a cadre of selected grant writers that, in certain circumstances where if your organization wants to write in a good amount of prevention plus wellness programs and training, we will pay a grant writer to write that grant if it looks like you have a good chance of getting that funded, because we want you to get funded and we want you to have the resources to implement our programs. So that's something you can always ask us about at info@preventionpluswellness.com. How info@preventionpluswellness.com. How can you partner with us? Refer interested colleagues and friends to PPW. Sign up to receive free webinars, as I mentioned, research resources, list PPW as a resource on for your colleagues, for your clients. We'd love you to share your use of PPW with your friends and colleagues. That's how we get a lot of attention. Order programs and training if you haven't implemented yet. Contact us for free Zoom consultation if you want to learn more. And we do give free materials to some organizations that want to pilot test one of our programs if they can set up a rigorous evaluation, a pre-test, a follow-up post-test, and even maybe a comparison or control group. So if you're interested in that, there's a link there to learn more. We have a bunch of PPW program resources. And there they are, again, under resources at preventionpluswellness.com. Learn more. There it is, our mission on the left, if you want to click on that. If you want to request the program sample on the right. And preventionpluswellness.com, our number is 904-472-5022. Info@preventionpluswellness is our generic email. So thank you. I'm going to pause now. We have about 5 minutes. See if anybody had any Q&A, any questions. Let me see if I have any. Where is my Q&A there? See anybody? Nobody. It's empty. So now's the chance. Now's the chance for you. If you have any questions, type in the Q&A. But I'm going to also look at the chat and make sure somebody didn't. Sometimes people will answer or ask a question in chat, but it doesn't look like it. It looks like just a lot of people are being kind and said hello and said thank you and said they've got other things in their life going on. Again, thank you for all you do with promoting the health and well-being of young people in your region, your families, etc. If we can help in any way, let me know. We're happy to do it. Yes, again, you will be today, unless something happens to me, you will be receiving a link today, all of you that have registered, and it'll take you to a page, actually one of our blogs, and on that you'll have a link to the recorded webinar. You'll have the slides. You can share both with your friends and colleagues, and then a certificate. You can type in your name and print out a copy for 1 hour CEU. Okay, so no worries, you'll be getting those things from me. You don't have to ask me for them. I will be sending those to you today. Let me see if anybody has a question or comment. So, apologize if you shared this already, but will this recording be shared? Yes, Jennifer, you're good. You're covered. The recording, the slides, and a certificate for CEUs. Thanks for asking that, Jennifer. And any other questions? A couple more chats. Thank you guys for. My job's easy. Your job is amazingly tough, yet critically important. So we're happy to partner with you doing the hard work and the essential work. So it's an honor to be working with you, all of you, any of you that want to partner with us. Let's see, there's another mention here. Has this been any, have there been any reviews on how this program has been received? Well, Alina, we've been providing this program for 15 years. The research came even before that, so we did research with hundreds and hundreds of kids. And so, yeah, we have a lot of feedback used in all 50 states. Go to our website, preventionpluswellness.com, scroll down, you'll see some provider comments from throughout the country. You'll have, if you use our programs, you'll have the pre-post survey, you'll get feedback from your youth. I can't say that everybody who's used our program has loved it, but I can tell you, in all honesty, it's highly valued by the students, by the providers, by the parents, by the agencies that you presented for a number of reasons. Evidence-based, whole health, positive outcomes. There's a flexibility, lots and lots of things. So look at our website, look at the database, Alina, look at the comments, and we're happy to send you a sample if you want to take a look at it. But you're right. I mean, what you need to do is start out, and most organizations will do this. Some organizations will buy a whole bunch of stuff, program manuals and training and licenses and that kind of thing. But many will start out small, a manual or two, a couple of trainings, and test it out. I mean, that's the way to go, I think, to make sure that it's going to work in your setting. But you have such great flexibility with this prevention program. It's going to be one of the most widely used prevention tools in your toolbox, trust me. And that's because that's what we hear from our providers. I will send you, Raul, the recording today as soon as it gets processed. We'll download it into YouTube and then we'll put it back on our website for you. So yes, you'll get that as soon as it takes time to process. Okay, last minute or two. If anybody else has a comment, now's the time to do it. Comment or question for me. Happy to answer if I can. Thank you for joining. Thank you for what you do. Hopefully you have a good day. I know you're wrapping up. Well, some of you are wrapping up your semester. Some of you won't be done until next. Those of you that work with schools, at least next month or so. But let us know if we can partner with you in some way by implementing our programs, by pilot testing, by grant writing, by whatever that you'd like to do, whatever works best for you in your particular organization and setting. All right, that is it. Thank you. Email. How do we get a certificate? I'll be sending that to you, Joel. You will be hearing from me. No worries. Don't need to reach out to me. I'll be reaching out to you very shortly today, later today. Okay. So relax. Enjoy your day. Have a good day. Thanks, everybody, for joining us. See you later.